All of us are feeling some bit of anxiety and maybe feelings of depression during this unprecedented time. But how do you know when it's time to reach out to a mental health professional?
I look at the timeline. So if it becomes very persistent, so if your bad days are starting to outnumber your good, that's a good way to gauge how you're doing. And I also look at if it's starting to affect other things. So if it's affecting your relationships or it's affecting the way you're doing your work, like you're not as productive now, those are the things that we pay attention to. So there's a timeline and how it affects your daily functioning.
Right now, in the middle of this pandemic, how do you go about reaching out to find a mental health professional? Because it can be daunting and really nerve-wracking for someone who's never seen a therapist. So how do we do it right now?
Right. So a lot of people think because of what's going on that it's harder to get into a therapist. It's actually easier now because we have more options. There's more people you can see, and the issue of distance is no longer an issue. So you can do everything virtually. Like since about over a month now, I've been just doing virtual sessions. And I always say there's nothing wrong with looking for a therapist that you think would be a great fit for you. So if you prefer a female, if you prefer somebody who works in a specific, kind of has specific expertise, all of that is okay. And there's lots of kind of sites that you can go to. I know Psychology Today is a great one where you just type in what you want and you can even put in your insurance and it can tell you who's listed in your state. So same way you go and you look at it because all of us are doing it virtually now.
We've talked about my experience with anxiety. I'm certainly keeping up with my therapy sessions right now, but you found that your clients, your patients who've experienced anxiety are doing okay right now.
It's very interesting because it's like they already have the tools in the toolbox. They know what this anxiety feeling is like, so they know the skills to cope with it. Whereas there's people who have never experienced this level of anxiety, where this abrupt change in our lifestyle has just brought on this whole new wave of anxiety that they've never had before. But I've noticed that people who have had experience in getting better and coping with it are actually doing better in terms of being able to cope with the daily fears.
But how do you know when it's time to open up the conversation about medication? And what would you say to someone who may be hesitant or fearful? What would you say to get people to open up their minds to the possibility of medication right now?
Right. So what I'd initially do is debunk the myth that if you talk to a therapist or a psychiatrist, we're automatically going to say you need meds. Sometimes there is this view of us that we're just kind of prescription pushers and we're like, oh, just take this, just take that. No, it should be more in depth. So we're looking at how you're doing, and you might not need medications, or you might. It all depends on the level of severity of the symptoms, but we go into it with an open mind. So I tell them still seek us out, still do the initial evaluation, and then let us be the one to determine if we need medicines, which one to use, and go from there. But I have some patients who they have milder depression and we don't need medication. So we just do therapy. So it's always tailored to the patient. You're not automatically going to get on medication unless you need it.
People feel guilty for feeling okay right now, or feel like they're treading water. What would you say?
We're in survival mode, so don't feel bad if you are feeling good. That is a good thing. You're having a good day. Don't feel guilty about it. I have a lot of patients who say, I'm feeling guilty because I'm healthy, or I'm grieving something that I couldn't do anymore. Like if you had trips planned, that people are kind of going through a little bit of grief because it was such an abrupt change in terms of having to cancel all those things. And also not knowing when we can reschedule them too also brings up some anxiety. So it's not like we're able to have things to look forward to. But I just say, if you have good days, don't feel bad about your good days. And if you need somebody, always err on the side of caution in terms of reach out. It never hurt to just reach out. Of course, I'm biased, but it never hurt to just reach out. And I just think there's so many benefits for therapy. There's no harm in getting an evaluation.